All right, hello everybody. So after laboring really hard through the night in the CFTCC hackathon, Team Broccoli Against Cancer finally have something to show the world. In our own little way, we hope we have contributed in some way to the fight against cancer. So members of the team, Juan, May, Haria, Habibe, and Leonard. And so we decided to make a mobile app, and people ask why. So the reason for this is because it's well known, supported by research, and everyone, well, it's more many people know that a lot of the reason why people die from cancer is because they wait until it's too late before they're diagnosed. And so the earlier you can diagnose the cancer, the easier it is to treat, and the higher chance of recovering and getting well. So in this case, we said we went out there, looked at the apps online on to help you diagnose yourself, and we couldn't find an app that you can just input your symptoms if you're worried about something, and it will tell you whether or not you should be worried, whether you should see a doctor, and whether or not you might have cancer. And so that means some people could have some symptoms which could be just not so harmful, and they may not realize they're actually in trouble. They may not realize they actually need to see a doctor. So we made an app where if you suspect anything, you see a lump or anything, just go to the app, put in your symptoms, and then it will tell you whether or not you have a high chance of having cancer and whether or not you can see a doctor. And our hope is that with that, we'll be able to get more and more people to seek help early enough so we can treat it much quicker. So this is the screen of our app. We call it Cancer Check, and yeah, that's what it is. And so basically, the first thing when you log into the app is you put your basic information, where you put male, female, age, weight, and this information is mainly to help us choose what kind of questions you'll answer. And also later on when choosing probability of which cancer you might be having, if there's any cancer, some cancers are predisposed to certain genders, cultures, and activities, and so this is part of the diagnosis. So you put in basic information, and then you put more information. For example, if you have cancer history in your family, type of cancer, member affected, and then you can put what part of your body is affected, and do you have pain right now, and the pain degree. And in this case, we say like, if you have really serious pain, for example, if you say your pain level is more than 5, then this app will just say, just go see a doctor. You probably need to see a doctor either way, even for cancer. But if your pain is less than that, then you can go to the next part, where you can now choose what part of the body. So head, ears, skin, stomach, and stuff. So in this example, for example, you say, oh, you have a problem in your throat. So you answer a few questions. You have a sore throat and expected weight loss. And these questions are specifically questions we chose from a list of symptoms that actually occur with in certain parts of the body associated with certain type of cancer. And so once you correctly answer these questions, for example, throat, there are these questions. The next week, answer the questions. Once you finish all the questions for that specific part of the body, you click Analyze. And then this app will go through the list of cancers we have on the database and give you the probability or whether or not you should be worried that you have a specific type of cancer. So I'll just go a few examples. So there's throat, you click Analyze. And then, for example, you have lung cancer. If you have problems in lung breathing, these are typical questions a doctor will ask, or these are typical questions a doctor will ask if you suspect somebody has lung cancer. So are you coughing, producing blood, breathing difficulties, loss of appetite, fatigue? And we hope that, if you have 3 or 4 of these out of 5 symptoms, then there's a high chance that you have cancer. Or this specific kind of cancer, you should actually get help. So this is for the lung, more questions, and you analyze, stomach, and the eye. And so once you click Analyze, you go through all the questions, put all the information, and you click Analyze. We'll go through the symptoms, check on the database, and tell you whether or not you should be worried. So if we find that your symptoms match a specific kind of cancer, so any cancer that, for example, depending on our algorithm, will give you a risk percentage of more than 30%, more than 1% will appear here. So stomach cancer, throat, skin, and eye, depending on the symptoms. So some of the symptoms might not be very clear, and so we just put the percentages. And we'll recommend maybe, for example, if your cancer risk is more than 30%, you should probably see a doctor. And then we'll have you either see a doctor. And But other ways in which to expand this app is mainly, maybe we could add connectivity to specialists in the area, so you can actually recommend a specific doctor. And then we can also have this app maybe send all the information to the doctor in advance. And yeah, thank you very much, and thanks for listening.